In the session, you will learn how to assess hand instruments for optimal sharpness, ensuring precise performance and enhanced patient care. We'll explore key indicators that signal when resharpening is needed, practical tips for maintaining instrument longevity, and strategies to improve clinical efficiency. Mastering this critical skill will help you maintain the gold standard of dental hygiene practice. I've created several resources to support your instrument maintenance journey, which I'll be sharing throughout this presentation. You can access them via the link here or the QR code provided. And I encourage you to download and print these resources to post in your practice as helpful reminders and to share with your team. Let's work together to elevate awareness and ensure everyone is on board with maintaining our instruments effectively. So the learning objectives, we're going to understand why maintaining sharp instruments is critical for optimal clinical performance, patient safety, and reduced practitioner fatigue. We'll identify the key signs of wear and dullness in dental hand instruments that indicate the need for resharpening. And we're going to implement best practices for maintaining sharpness and extending the functional lifespan of dental instruments. Green Vardaman Black was one of the founders of modern dentistry in the United States. He is also known as the father of operative dentistry. G.V. Black so famously said that all those years ago, nothing in the technical procedures of dental practice is more important than the care of the cutting edges. No man has ever yet become a good and efficient dentist until after he had learned to keep his cutting edge sharp. This statement, made in 1908, still holds true and is as relevant to the dental profession today as it was then. Maintaining sharp instruments is not just a daily task. It's the foundation of clinical excellence, patient comfort, and clinician longevity. Let's honor this wisdom by committing to the care and precision our instruments deserve. Before we dive into the details of when to resharpen dental hygiene instruments, let's just take a moment to reflect on the why. Why is it essential to consistently use sharp, well-maintained instruments in our practice? And why should we sharpen frequently? Understanding the rationale behind this practice not only reinforces its importance, but also enhances our commitment to delivering precise, efficient, and comfortable care for our patients. Let's explore the key reasons why maintaining sharp instruments is critical for both clinical success and professional well-being. Using sharp, well-maintained instruments enhances precision and control. Sharp instruments enable a thorough, more precise debridement, reducing the risk of removing excess tooth structure or causing unintended trauma. Using sharp instruments improves access to subgingival areas. A clinician will struggle to reach tight or challenging spaces, compromising care quality. Sharp instruments provide better access to difficult areas. It increases tactile sensitivity. What is tactile sensitivity? Tactile sensitivity is the clinician's ability to detect and interpret subtle differences in tooth morphology, root texture, and calculus deposits through their instruments. It is fundamental skill in periodontal instrumentation, allowing for precise adaptation and effective removal of deposits. Using sharp instruments minimizes the risk of burnishing calculus. Dull instruments often smooth over calculus rather than removing it, creating barriers to effective periodontal therapy. Burnished calculus is a deposit that has had its outermost layer removed, leaving a smooth surface. It is commonly found on root surfaces with developmental grooves, depressions, furcations, and at the cemento-enamel junction. Dull instruments are a significant cause of burnished calculus. If a hand instrument is only somewhat sharp at the onset of scaling, it will remove only the first few millimeters of the deposit, leaving the remaining calculus intact. Sharp instruments are far more effective, enabling faster and more efficient removal of calculus and biofilm. This results in more productive, timely appointments for both the clinician and the patient. Have you ever experienced treatment with dull instruments? I have, and I can tell you I was in the chair far longer than necessary, and it was far more uncomfortable than it should have been. Which brings me to this slide. Sharp instruments help improve patient comfort. Dull instruments require more force, increasing patient discomfort and at the risk of tissue trauma. In contrast, sharp instruments allow for a smoother, gentler experience that benefits both the clinician and the patient. How often do we hear patients say after an appointment that dental hygienist was too heavy-handed and they don't want to see him or her again? That reality is usually not the case of them being heavy-handed. It usually is the result of using dull or poorly maintained instruments. And here's something else to consider. Many patients won't complain at all. Instead, they'll simply decide to leave your practice and never return. Prioritizing sharp, well-maintained instruments enhances patient comfort, improves trust, and ensures they will return for the quality of care that they expect. Using sharp instruments requires less effort and less force, which means less physical stress, enabling clinicians to sustain long careers without compromising their health. Less force minimizes strain on the hands, wrists, and arms and reduces the risk of repetitive strain injuries. Numerous studies spanning over 20 years consistently show that dental professionals are at a high risk for repetitive strain injuries, such as carpal tunnel syndrome. Despite this long-standing awareness, these issues persist in our profession. Why are we still compromising? Why are we using dull, poorly maintained instruments and thinking it is acceptable just for one patient? The reality is, it doesn't just stop at one patient. It becomes a week, a month, or a year or more of unnecessary strain. We need to shift our mindset and treat our instruments as an extension of our body. Taking care of our instruments means taking care of ourselves. Regularly sharpening of instruments not only extends their lifespan, but also saves you money in the long run. Waiting until an instrument is completely dull means removing more metal during sharpening, which shortens the instrument's usable life. Additionally, working with excessively dull instruments requires more effort to restore their sharpness. If you outsource sharpening or are paying an employee to sharpen, this added effort translates to higher costs. By sharpening at the first sign of dullness, you ensure efficiency, prolong the instrument's life, and minimize expenses. Take pride in your work. Elevate excellence through well-maintained instruments. Using well-maintained instruments reflects your commitment to clinical excellence, enhancing both your professional credibility and the overall perception of your practice. When instruments are sharp and well cared for, you can feel proud that you are delivering consistent clinical outcomes, and predictable high-quality results lead to greater patient satisfaction and trust. Sharp, well-maintained instruments align with evidence-based practices and elevate the standard of care you provide. By prioritizing this, you're not only improving outcomes, but also building a reputation for excellence that sets you apart. Encouragement of a proactive mindset. Instrument maintenance fosters a habit of proactively addressing potential challenges, reinforcing a culture of thoroughness and attention to detail. So I've created this resource I will share with you of all the reasons why we need to sharpen and why we need to use sharp instruments. Here are some key signs to look for when determining if dental hygienes need resharpening. When an instrument loses its sharpness, it no longer engages calculus effectively. Instead of precisely removing deposits, it starts to slide over the surface, making debridement more difficult and less efficient. This means you may find yourself applying more pressure or needing to take additional strokes just to achieve the same result. Next is the visual changes. Over time, repeated use and sharpening can lead to visible changes in an instrument's blade. Instead of maintaining its original precise cutting edge, you may start to notice rounding, blunting, or flattening of the blade. These changes significantly impact performance. A dull, blunted instrument no longer grips and engages calculus effectively. Instead, it slides over the deposits, making it difficult to achieve thorough debridement. You'll also notice some flattening. The flattening can also distort the instrument's original design, affecting adaptation and angulation. This means more effort, more strokes, and increased clinician fatigue, all while compromising patient comfort and treatment efficiency. Tactile feedback is one of the most critical indicators of an instrument's sharpness and effectiveness. When an instrument is sharp and properly maintained, you can feel it engage the calculus, biting into the deposit for effective removal. However, as an instrument becomes dull, that tactile sensitivity diminishes. Instead of gripping and removing the deposit, the blade glides over the surface, making it harder to detect and remove calculus effectively. A lack of tactile sensitivity can lead to over-instrumentation, requiring more strokes, more pressure, and ultimately increasing fatigue and strain on the clinician's hands. It also reduces precision, making it difficult to achieve optimal clinical outcomes. Pay attention to how the instrument feels in use. If you notice a lack of tactile sensitivity, it's a sign that sharpening or replacement is needed to maintain clinical efficiency and patient care standards. When instruments are sharp and well maintained, they work with you, not against you. A sharp cutting edge engages the deposit efficiently, allowing for smooth, controlled strokes with minimal pressure. However, when an instrument becomes dull, more force is required to achieve that same result. Instead of the instrument doing the work, the clinician has to be compensated by applying greater lateral pressure, which increases strain on the fingers, the wrists, the forearms, and the shoulders. Over time, this added stress can lead to hand and wrist fatigue, increased risk of repetitive strain injuries, muscle soreness and long-term discomfort, and reduced precision due to hand exhaustion. This is why functional safety is so important, not just for instrument longevity, but for clinician well-being. Ensuring that instruments remain sharp and ergonomically efficient is a proactive step in reducing fatigue, preventing injuries, and promoting career longevity. Using dull or worn instruments doesn't just impact the clinician, it also affects efficiency and patient experience. When instruments lose their sharpness, again, more strokes are needed and more time to achieve the same results. So this leads to prolonged time in the chair, patient discomfort, reduced scheduling efficiency. And in contrast, when you use sharp, well-maintained instruments, procedures are more efficient, more comfortable for both the patient and clinician, and better for practice productivity. Instrument sharpness directly impacts the patient's experience. When an instrument is dull, it requires more force and additional strokes to remove deposits, increasing the risk of tissue trauma and discomfort. For the patient, this can mean increased sensitivity during and after the procedure, unnecessary pressure and pulling, leading to discomfort or even pain, and it leaves them with a negative perception of the hygiene visit. One of the most obvious indicators that an instrument is no longer functioning optimally is visible wear and damage. And if you see little nicks or bends or thinning along the blade, the instrument's sharpness and structural integrity are compromised. Over time, excessive sharpening can lead to a beveled edge or a blade that becomes too thin, making reshaping difficult or even impossible. And at this stage, continuing to use the instrument not only affects performance, but can also create functional safety concerns. So when an instrument reaches this point, resharpening may no longer be effective, and it's time to replace it to maintain clinical precision and safety. Keeping a master set of instruments for reference can help you compare and determine when a tool has reached the end of its functional lifespan. So I've created this resource for you, the key signs of instrument wear, that you can print as well and post in your practice. Okay, so what are the best practices for maintaining sharpness and extending the functional lifespan of dental instruments? The use of ultrasonics. If you're using ultrasonics, say 80% of the time, you're going to get a longer time out of your hand instruments. Using instruments for the correct application. Each instrument is designed for a specific purpose and application. So using the appropriate instrument for its intended function not only ensures clinical precision, but can also help you extend the lifespan of the instrument. Sharpen as required. As I mentioned earlier, if you leave it until it's super dull, you're going to have to remove more metal, and you'll go through those instruments faster. When you are sharpening, be gentle and precise. Best practices for extending the lifespan of your instruments. If you focus on, rather than focusing on the whole blade, just focus on a couple of millimeters at a time when you're sharpening. And this targeted approach helps you maintain control, preserve the original design, and avoid removing unnecessary metal, ensuring a longer lasting, sharper edge. When sharpening instruments, one of the most critical factors to consider is maintaining the original design. Every instrument is meticulously crafted with specific angulation, curvature, and blade width to optimize performance. If we over sharpen or alter the shape even slightly, it can impact the cutting efficiency, tactile sensitivity, and overall functionality. For example, reducing the blade width too much can make the instrument less effective, requiring more force and leading to clinician fatigue. Use a sharpening guide when you are sharpening. It's essential to ensure precision and consistency when maintaining your instruments. Without a guide, it's easy to alter the instrument's original shape, which can impact cutting efficiency. Use a high quality dual-sided sharpening stone. This particular stone here has a coarse side on one side and a fine medium on the other, so that you don't have to use a coarse side every time. You only use a coarse side when needed. Otherwise, you're just using the fine medium side. Or you can always use a power sharpener. For those who are looking to improve consistency and efficiency, a power sharpener like the LM Rondo Plus may be a game changer. Test for sharpness. When sharpening your instruments, it's essential to test for sharpness to both avoid over sharpening and under sharpening. Using a test stick, gently glide the instrument's cutting edge against it. A properly sharpened instrument should grab into the test stick, indicating that it's a nice sharp cutting edge. But if the instrument slides over the test stick, it's showing you that it's dull and will need more sharpening. Okay, and always keep a master set of instruments. In order for us to maintain the original shape and design of the instrument, we really should keep a master set on hand. So do not use this for clinical procedures. Keep it just as a master set so that you can compare the instruments that you're using, what they should look like, so that you can maintain that original design. But it can also help you if you do have to speak with somebody about getting new instruments. You can show them this is what I'm using and this is what I should be using. Invest in high quality instruments. When it comes to instrumentation, investing in high quality tools is an investment in your clinical efficiency, patient care, and long-term cost savings. High-grade steel instruments are designed for durability and longevity, lasting much longer than a cheaper instrument. Also, proper sterilization care. Ensure that you're always following the manufacturer's instructions for use, and maintain an adequate number of instrument kits. I often get asked from people, I only had those instruments for, 6 months. Why do I only have those instruments for 6 months? And then after I do a little bit more investigating, I discover that they only have 3 or 4 kits to get them through their day. So they're using these instruments twice a day. So really, they're getting a year out of their instruments. So I'm a big believer in having enough kits to get you through the day, so you don't have to worry about sterilization. You don't have to worry about, are those instruments ready to be used? You know that you have enough kits to get you through the day, and your instruments will last you longer. And I created another resource here that I'll share with you on best practices for maintaining sharpness and extending the functional safety of your instruments. All right, so sharp judgment leads to excellence. Resharpening your dental hygiene instrument, it's not just about maintaining tools, it's about upholding the quality of care, ensuring clinical precision, and protecting clinician well-being. By committing to consistent maintenance, you reduce clinician fatigue and risk of injury, improving your longevity in your profession. You enhance patient comfort with a smoother, more efficient instrumentation. You ensure consistent, high-quality results, which foster trust and satisfaction in your patients. Remember, resharpening is not an inconvenience. It's an investment in your practice, your patients, and yourself. Make sharp instruments your priority and let precision be the foundation of everything you do. Sharp tools, sharp results, and a sharper standard of care. And here are the results again for the resources that I'm going to share with you. So just visit that website there, or you can scan, and I will send you all these resources that you can download and print as a reminder of all the reasons why we need to work with well-maintained instruments. And thank you so much for joining me. I would love to stay connected. We love to have you in our growing global community as we work together to elevate our profession, enhance patient care, and support each other in achieving clinical excellence, no matter where we are in the world, where you practice. Stay inspired, stay empowered, and keep elevating our profession globally.